giving patients quality care that keeps them well so they can live their best life. That is our mission and commitment to our communities. Every day, people throughout our borough visit with a wide range of providers for anything from a routine checkup to receiving emergency care. Today, doctors have the ability to access patient medical information and coordinate with each other to give patients the care that they deserve. You are a patient's first line of care. You have a vital role in making sure that doctors have the information they need about a patient's medical history to make the best treatment decisions. Your organization is a member of the Bronx RHIO, which is certified by New York State to operate a health information exchange. A health information exchange makes it possible for doctors and other healthcare professionals to access patients' medical information from other providers so they can provide quality, coordinated care. Patients benefit in many ways. Doctors see their complete medical picture and previous medical care. Patients avoid duplicate tests and additional costs. Doctors can coordinate to provide better care. Primary care physicians even receive an alert when a patient is registered to the ER or the hospital's inpatient units for care. Patients get better treatment in real emergencies because doctors have access to their complete history. In order for a doctor to access a patient's medical records from other providers through the RHIO, a patient must give their consent. Here is an example of how patient consent works. A patient visits her primary care physician for an annual checkup. She signs a form giving her primary care provider consent to access her health records that are in the RHIO. A month later, she visits the hospital feeling ill. While there, she gives the hospital her consent to access her health records that are in the RHIO. The emergency room clinician is able to view the patient's records from her PCP and sees the details of her most recent visit, including blood pressure, heart rate, family history, and diagnoses. Because it was an emergency, the patient's PCP received an alert about her recent ER visit, and now the PCP can follow up with the patient. The PCP can also review the medical records from the patient's ER visit. As you see, patient consent gave the PCP and ER clinician the information they needed to consider her treatment options and to follow up on her care. All organizations that are members of the RHIO have a print or electronic version of the standard RHIO consent form with similar language. For many organizations, the form will include two choices, of which the patient can check off one. Some organizations, usually a hospital, include a third option if they have one of these three departments: an emergency department, labor and delivery department, intensive care unit. In the third option, the patient may consent for the organization to access his or her health information only for emergencies. To complete the consent form, your patient must provide name, date of birth, signature, date of consent signing, their consent choice. It is important that all fields are completed for the form to be valid. Once the consent form is signed, regardless of which option is chosen, their choice will be recorded in your institution's electronic medical record, and the form should be properly stored since it may be needed for future audit. Remember, the consent form is not mandatory, and there may be occasions when the patient opts not to sign at all. In that case, the patient's consent value should not be adjusted in the electronic medical record. there are a few additional rules regarding minors and consent. In most cases, when a minor patient, someone under 18, visits a healthcare provider, the minor patient's parent or legal guardian is responsible for signing the RHIO consent form. Once that patient turns 18, he or she is responsible for signing their own consent form. In New York State, there is an exception to this rule called minor consented services, which allows minor patients to consent for their own care when they visit a provider for certain approved services. Those services include reproductive health, family planning, abortion services, substance abuse, and mental health. Additionally, New York State has a form called Parental Consent Override that allows the minor patient to give the provider one-time access to his or her health records in the Bronx RHIO. Only providers who have been identified as working in minor consented services may collect and invoke Parental Consent Override. Finally, and very importantly, let's look at how to obtain consent. In most circumstances, it is easier and more efficient to have the consent form signed during registration and intake. Many providers include the consent form with the registration packet. At certain times of the day, your office may be hectic or you may be facing many responsibilities at once. Visiting a provider's office can also be stressful for patients. Some patients may sign the form without any questions. Others may have concerns. If asked, you can be calm, assuring, and positive as you explain the purpose and the benefits of giving consent. You might say to your patients that the consent form gives the doctor permission to obtain their medical information from their other doctors. This can include tests they've had, medicines they are taking, and recent hospital visits. That way, if the doctor wants to order a test, he or she can find out if they've already had the test before to save them time and inconvenience. The doctor can compare any tests he takes to previous test results from another doctor. The doctor can know what kind of medication they are taking before he or she prescribes them anything. You can reassure your patients that this information is used only to benefit their health. It will not be shared without their consent, and they can revoke consent at any time. Their records are confidential. Only their doctor and authorized users can access their information, and only with their permission. It is not mandatory to give consent. Patients can always change their mind and complete a new form. Their provider will see them no matter what they decide. Quality, coordinated care. Your commitment to obtaining patient consent can help us meet our promise to our patients.